particularly its active ingredient curcumin, has been found to have potential benefits for arthritis. Here are some key points. Anti-inflammatory properties. Curcumin, the active ingredient in turmeric, has anti-inflammatory properties. This makes it a potential treatment for a number of health conditions, including arthritis. Pain management. Research suggests that curcumin may improve symptoms of rheumatoid arthritis, RA, and osteoarthritis. It may help reduce pain and increase ease of movement. Research findings. In a small 2013 study of 450 people with RA, the group that took 500 milligrams of curcumin showed the most improvement. Another study found that curcumin was as effective as an anti-inflammatory drug in relieving knee pain. Consumption. You can consume turmeric as a spice, in tea, or as a supplement. However, curcumin has poor bioavailability, which means it's poorly absorbed. It would need to be taken at large doses for an active effect.